people who are right-handed typically, and many people who are left-handed, the left hemisphere of the brain is really well equipped to process language. And so when there's a stroke on the left side of the brain, any issues that people have with language or damage to the language system, they have what is called aphasia. In aphasia, we see issues with many modalities of communication. So people might have difficulty with reading and writing, speaking and listening, signing. And so we see issues because of damage to or disruption in the conceptual meaning of words or their semantics. It could be due to issues with understanding the sounds of the words or assembling the sounds of the words or the phonology. And we can also have issues with the grammatical structure and knowing how to put sentences together or interpreting sentences from people or groups of sentences like at discourse level. So people with aphasia can have difficulty with their fluency, so how easy they're able to express their ideas, whether it's in a sentence or maybe it's single or a few words at a time. They can also have issues with repeating words that they hear or sentences. They might have issues with comprehension, so hearing or reading something. And across different types of aphasias, we see that word finding is very difficult. So coming up with that word that someone wants to use to label a picture, to include in a sentence or at the discourse or multiple sentence level, that word finding is really difficult. So the left hemisphere is very strongly suited to process language, but the right hemisphere is also involved, but in processing language a little bit differently. So there's an effort by a group to redefine the term apragmatism to describe what happens to language and how it changes after a right hemisphere stroke. And that term apragmatism includes a couple of different components and all center around how we use language. So the linguistic component, people might struggle with interpreting inferences or being able to interpret multiple meanings of a word, such as idioms or metaphors and other non-literal language, humor, or being able to use those elements in their communication. And then the paralinguistic component is when people might have difficulty using or understanding tone of voice to express meaning. So we see that in being able to interpret the emotion from someone's voice, or maybe being able to understand if they've been asked a question or a statement. And so expressive paralinguistic or expressive prosody issues are then just the difficulty with that person themselves being able to use their voice to express emotion or a different type of sentence. And then the extralinguistic component is when there might be difficulty with features of language like turn taking or body language and gesture, and how that helps drive communication and make it successful or maybe unsuccessful.